Welcome back to Seven Rivers Health, and we talked earlier about advanced directives, and one of the things that you come across when working on those advanced directives is the possibility of donating your organs. And here with me is the donation liaison, Jodi Gonia from Franciscan Skemp Healthcare, and let's talk about donating your organs and basically how important is it to possibly just have that thought in the back of your head of maybe donating something.
Well, there's a huge need, Rick. We have right now over 105,000 people waiting for a life-saving organ, and that in every 18 minutes we have another person added to the waiting list, and we have people dying daily waiting because population's getting older. We all have a need, have a need for a life-saving organ. So if there's an opportunity for donation, we want families to be discussing it and talking about it and indicating those wishes.
When when should you start possibly considering the likelihood or even the thought of organ donation?
Well, typically it starts in the state of Wisconsin, usually with your driver's license. They get mandatory education to learn about the opportunities for donation, but actually any time, and especially if you're thinking about an advance directive or working on that, it's an opportune time because, again, it indicates all your wishes for end-of-life care. Anyone from a baby as little as 6 pounds up to, we don't really have an upper age limit, have a potential to offer gifts of donation at the time of death. So there really is not an age limit.
How do you discuss it? I mean, is it something that you just right down the middle, just say, okay, this is something that's well worth it, and I need to do it? Or how do you kind of come up with that decision? Or how do you maybe talk to people about that decision?
Well, we hope that through community education and a lot of these kind of programs where people learn about it in a kinder, gentler, in their living room, around their supper table, hear about it through a speaker, that they learn about the gifts and the opportunities so that when they are in an ICU and facing a tragic situation for their loved one, that those issues are not coming up. But we are mandated by law, if a patient meets criteria, to discuss those opportunities for gifts. So there are two options. You can talk about it when it's a good time for your family and share your wishes, or your family will be faced with it perhaps at another more tragic time.
How simple is it to becoming an organ donor?
You can indicate your wishes on your advance directive, on your driver's license, and as of April 1st, state of Wisconsin is now joining 47 other states to get an online registry. And by going to a simple website that we'll include at the end of this program, you can purely just click on, indicate your wishes, and that is first-person consent. So if you're hospitalized, not going to survive, we can access that registry, our recovery agencies do, and we would know your wishes.
Now, the problem sometimes is the fact that not everything can be donated from a person or an individual. How does that happen, or how's the decision process of what can be donated?
Everyone is evaluated at their time of death or impending death. So it's a federal mandate that we, in a critical care setting, if you're intubated and on a ventilator and not going to survive, that we notify our recovery agency. And we work with the University of Wisconsin-Madison. They would walk through the medical diagnosis at the time and tell us if there's an opportunity for a donation. It depends on the health you are at the time of death. Certain infections might preclude tissue, bone, and skin donation, but otherwise, many times, organ donation is offered in a lot of opportunities. So we screen at the time and know that you would be evaluated appropriately if there's that opportunity.
And how does that, I mean, what's the process from there as when it's donated? What's the process? Do you kind of know the idea of how that happens?
Yeah, we notify our recovery agency, again, out of University of Madison. They would start automatically with, once they get blood typing and lab work, start looking for their sharing list, the United Network for Organ Sharing List, the potential recipients. But then we coordinate with the UW, has a very synchronized teamwork to manage the donor, and then when it works for them having both the recipients ready, they would fly down and the recovery happens in the operating room under sterile procedure. The family is not charged any additional costs, and it doesn't preclude any of your original or planned funeral. We coordinate all that with the family and honor their wishes on how their end-of-life care would go.
Why do you think so many people don't donate?
Well, Well, we know that probably up to 60 to 70% of people agree to donation when they talk about it in the general. Sometimes when they're faced with that tragedy, it's not something they can think about at that time. But we also know that less than 2% of the population actually die in a way that organs are able to be recovered, because you do need to be in a critical care setting, on a ventilator, getting oxygenation, ventilation, and hydration. There is opportunity for bone tissue and cornea donation, and we have at least 50% of the population usually agrees to that. And those gifts are given for orthopedic surgeries, helping someone who's losing their eyesight. Skin is used for burn patients and other surgical procedures. So there are many ways that we can give our gifts when we're no longer using them.
Is there an area that needs of greatest of need right now?
Kidneys are our biggest need. Over 75% of the people waiting are waiting for a life-saving kidney. And we know that many people who are very sick can still have very healthy kidneys, and some very young people who are there's a big need, and more and more people as we get older, larger population, more cardiovascular disease, those need for kidneys are going to continue.
And maybe one of the things people at home may want to consider is what if you're a family member who is in need of a kidney or a heart or something to that matter? How difficult is it for those family members to kind of just sit there and maybe hope and wait, I guess?
Families who are waiting tell us it's just a very roller coaster of emotions. You have that guilt factor that someone has to die in order for a life-saving organ to come your way, and yet the fact that you may live a new life and not be on dialysis is totally amazing to them, but they're waiting all the time for a phone call. They have bags packed, just like when you're waiting for a baby to be delivered. You have a bag packed ready to go to the hospital when you get that phone call. And many times there's 1 or 2 dry runs that they get a call, and that for some reason that organ isn't healthy enough or not be able to be transplanted, and then they sit back and wait again. And
the simplest thing to do is just a little check mark or go to a website and all that kind of stuff.
And talk to your family. We want family to be in agreement also.
Jodi Gonia, thank you for coming in talking about this. We'll be back right after this.
Okay.